Okay, I think we're going to get started. First of all, welcome everyone who's physically in the room and those of you who are online. We are here today to launch our business intelligence platform for our 211 data. It is a dream come true for me. Andrew and I have been involved in many conversations over the years of trying to make the data come alive, and Andrew came up with the perfect solution, at least for us. So we're so excited to have you here today and to share in our success. Now, we have not shared this with United Ways yet because we want your feedback as stakeholders so that when we're ready to provide the information for the United Ways and actually see it, where we have really good feedback about, is it helpful? What else would you like to see? What was confusing? Because we want to make sure that our United Way partners are fully satisfied as well. So you're the first to see it across anywhere in the United States. So we're the Toronto and Nova Scotia? And Alberta all are on the platform already, but we are the first in the United States. So we're very excited. First, I'd like to welcome Andrew Benson to North Carolina. We gave him a little tour of Raleigh last night. He said we have a beautiful green state, which we sure do. So Andrew had been very much involved in 211 in Toronto, helping guide that system through many platform changes and conversions and making it a quality-driven organization. And then Andrew's branched out now and you can talk about what you're doing yourself, but I'm very pleased to present Andrew, and we're going to have him just start us off.
Wonderful. Thank you very much, Laura and Heather, and for the rest of the team for inviting me here, and for all of you for being here physically in the room and virtually on the phone. Just a little bit of housekeeping. If anyone on the phone cannot hear or see, please just type into the chat window and we will fix those issues. So again, thank you very much for having me down here to Raleigh. Flying in yesterday, and I've driven through as a child actually, my way to Myrtle Beach or down into the deeper south. And flying over in North Carolina is absolutely gorgeous. I can't believe how many trees are in this state. It's an absolutely gorgeous state. Makes me think I want to move down here until I was told about the 6-foot copperhead snake. And I'm terrified of snakes, but absolutely beautiful, and thank you very much for the tour of your city last night, and I look forward to seeing a little bit more of the state. Today, I have the pleasure of presenting to you, if we can move the slides here, the business intelligence, or as I like to refer to it, the community intelligence system, and I'll get into this in more detail over the next 45 minutes or so. But I've been with the 211 system now for probably about 6 years and really focused on technology in the last couple, but it's absolutely remarkable to me, the people on the phones and creating these resource databases and their empathy on the phone, their ability to track information. It is incredible, the data that's collected on callers and other types of issues that you're hearing coming in over the lines and being able to record that, because without that information, you cannot have what you'll see today, high-quality business intelligence, community intelligence information. I'm going to walk you through a little bit, just briefly, what 211 is, for those who may not be familiar with the 211 service. I'm then going to introduce to you a little bit of the theory around how we approach business intelligence, because it's a different approach as to how we approach this platform. Then I'm going to walk you through some static screenshots just so you can get familiar with what the content is of the platform, and then I'm going to do a live demo. That's where I'll spend about half the time today. I'd like to leave lots of time for Q&A, both on the phone and in the room, and please feel free as well to interrupt me during the presentation. I'm very comfortable with that. A little bit about myself. I love the nonprofit sector. I have been a volunteer for most of my adult life now. But primarily, having worked in the community service in the 211 space, I worked as the executive director of Ontario 211 Services in Canada, and a big part of my role there was to help really transform that system where we have, at the time, 7 call centers, and figure out really how to harness that collective capacity of the province and the resources and bring all that to bear so we could provide a highly integrated quality service for Ontarians. I then worked with the United Way system across Canada to understand and to implement a platform that could scale. and everyone across Canada could take advantage of that. That's a work in progress. We're about halfway there. We're into Nova Scotia, all across Ontario, Alberta, and the other provinces will line up over the next couple of years. The last thing I'll mention about myself is passion for data. Share a story with you that I would say probably changed the trajectory of my career. I started life as an economist in British Columbia. And I remember writing a paper collecting all of this data on multiculturalism and immigration, analyzing that data for 6 months, and then putting that out into a policy paper only to find that the decisions had already been made. And they should. After 6 months, people move on. That's what pushed me into intelligence, realizing that if you can get that data into the hands of decision makers quicker, I can add more value. So that really sort of pushed me into the business intelligence space. Another piece I'll share with you is we used to collect a lot of data in multiculturalism and immigration for the purpose of really providing grants to settlement services agencies all across the province. There's about 250 communities. We used to hold on to that data and we used to evaluate grant applications based on the data that we had. And I had a wonderful mentor that said to me, why are we doing this? Why do we not push this data out to others and let them use that data so that they can form better grant applications so that they can understand their communities just like we do and provide us excellent applications? And that's what we saw. We started to see just quality applications come in. And so those are sort of the two pieces that I think affected me early in my career and pushed me into really this path of trying to build systems that create data and put it in the hands more quickly of decision makers. Okay, so for those of you, and I believe most of you are already familiar with 211, so I'll just be very brief on this. Absolutely remarkable service. Amazing. We're at about 62% coverage in Canada. You're 90% plus in the United States. Absolutely remarkable. People that basically are on the phone and you tell anyone in this country, dial these 3 numbers and someone will be there to listen to your issues and help direct you to resources in your community. I think it's just an absolutely incredible service. So what does that mean though in terms of its capabilities? Obviously it's an easy point of access to help navigate the human services resources in your community. It's free, it's multilingual, and it's available 24/7, 365 in most places. Underlying all of the great advice and direction coming from information referral specialists, obviously, is a database. And that database, I would argue, is the most comprehensive, standards-driven database of community, social, and health services resources, in particular from where I'm from. I hope that's the case as well across the United States, but it is an extremely comprehensive database, and it's standards-driven in the sense that there are rules around collecting the data and how often it needs to be updated and maintained. 2 ways, obviously, 2 main channels. I understand there's text and chat, but the 2 main ways to access the service, obviously, is by phone and online through your nc211.org portal. And similar to Ontario, you have 100% coverage across the state, and as I mentioned, 90% coverage across the United States. When I first was introduced to 211, I really tried to boil it down to what are the main components, what are we really adding to in terms of value in this space. And I broke it down into three areas that seem to sort of hold across North America. The first is obviously the information referral service itself, where callers are calling in and being greeted by these incredibly empathetic and skilled agents, operators, information referral specialists that are able to hear the issues. And often these are complicated issues, tangled and really having to untangle them and provide direction to the caller. Making the referral obviously based on the resources available to you in that database. And then what you'll see today is that incredible data that's being collected at the time of the call. It's phenomenal to watch an information referral specialist working and listening and talking and at the same time collecting this data. All of that data is being driven into these back-end systems. So what I saw in Ontario and in Canada was, wow, look at all this value, but it's trapped in these line of business systems. How do we get it out? So that's where we launched into business intelligence. A little bit about North Carolina. Remarkable 129,000 calls were answered in 2016. 15 million calls plus, I believe, answered across the United States last year. And your database alone in North Carolina, 19,000 resources delivered through 8,000 agencies and 11,000 programs / locations across the state. That's a tremendous amount of data, and the wealth of that information at the fingertips of information referral specialists or on demand coming in through nc211.org is incredibly valuable. So what are we talking about? I've first talked a little bit about that information coming through the information referral specialist in the top right from the caller being collected inside of a call reporting system. And that's typically where the story stops in Canada and as well across the United States. So the challenge was here, how do you take the data that's coming from these applications that the information referral specialists are using and present that in a way to policymakers, decision makers, to funders? How do you bring that data to the surface so decisions can be made? And what we're talking about here is being able to really clean that information, make sure it's high quality data that's coming through that can be analyzed by your analysts, by your decision makers, and being presented in things such as self-service portals, automated reports, and dashboards. And then, most importantly, how do you push this out to your audience? How do you target this information out to those who would benefit from it? So a little bit, and I'll go through this quickly, about how we approached the development of the system. This is more of my principles I would suggest to you than generic principles. But before we go there, business intelligence, what is it? It's the delivery of accurate, useful information to the appropriate decision makers within the necessary time frame to support effective decision makers. That's probably the most succinct sentence I've seen that describes business intelligence while I've been doing this work. In terms of how I approach, I think others approach building out these portals, if you will, or reports, dashboards, is you really have to keep three things in mind. The first thing is we're really trying to help people be confident in the decisions that they're trying to make. The information doesn't replace context. It doesn't replace experience. It's meant to augment that. But data can really help people feel confident about the decisions, whether it's a gut decision or whether it's surrounded by tons of experience, years of experience and context. But it can help people feel more confident. This is my personal favorite, number 2. The tools that are available to us now. Go back 10 years ago, you could not do, there's no way I could stand in front of a group and train people to use the business intelligence tools in a day or two. It just was not possible. It was too complex. It was more geared, that world, towards programmers. Today, the world has changed. Technology has created business-friendly, user-friendly tools, has made the cost point so affordable, it's incredible. So now, really, we can get the data into the hands of people like never before. So for me, I love walking into a room, and even though we're talking about tools typically, what I love seeing is sort of the capabilities of the audience or the users really start to increase, and them starting to use that information. And probably as equally important is number 3. Publicly demonstrating the impact of your programs. We're all competing for space to demonstrate the value of our service. There's tremendous value to be able to demonstrate that through 211. So being able to bring that to the surface is absolutely critical, and one of the components or driving sort of principles that I have in my mind while we're building this out. The benefits of business intelligence: prioritizing opportunities for greatest potential social return on investment, quantifying your results, demonstrating accountability for public dollars, allocating resources in an equitable and transparent manner, and empowering people to feel confident in decision making are some of the key benefits of an intelligence system, especially as it matures over time. So how's business intelligence different than your typical reporting environment? There's a couple of things here. The first is that the creators of the intelligence, whether it be dashboards or reports, whatever it be, that asset, is typically created by the business user, the person who actually understands the business and not just the data. As I mentioned, those business sort of friendly tools now allow people with that rich background in delivering the service or in managing the service to really look at this data and work with the data. So that's quite important. The other piece is that the tools now that are available allow us to model this data, and I'm going to demonstrate this a little bit later. But not only are the reports created and the dashboards created for you, but you also can analyze this information at a pretty detailed level, whether you want to connect to it directly or not. The other piece, and in no way do I diminish IT's role in all of this, because IT is very important in this, but what we're doing is we're getting away from having bottlenecks in pushing information or creating intelligence that typically has resulted from having to basically get in line to make the request of your IT department. And putting those tools in the hands of business users is quite powerful. On the flip side, what it does is it frees up your IT department to really focus on those things that are critical to implementing intelligence. So you can get your product out quicker, you can allocate your resources a little bit differently, but there's obviously a very important role for IT, but it's not just having to write these reports and you getting in line anymore. This is a slide pulled from Gartner, and I'm putting this in here to describe where most people are at when you start this BI journey. You're in the far left, just like we are in Ontario and Canada. Far left is descriptive analytics. What we're talking about here is business intelligence or community intelligence that is describing what's going on, what's happening, being able to count things, being able to understand sort of what's happening today or what happened yesterday. Moving forward, these platforms can be evolved, so you can ask questions, why did it happen? So you can look at data and look at the relationship. You probably heard about machine learning or cause and effect kind of analysis. So then you can start taking this data and understand, okay, that happened, but why did it happen? And demonstrate that there is a relationship there, which leads you then to the third bubble on the right, which is around predictive. So if you understand how it happened or why it's happening, what the relationship is between these things, you're able then to start forecasting and becoming more proactive in your service. So your data will tell you. It might be an outbreak of some flu epidemic or something else that triggers that prediction or that forecast, helping you get out in front of these things. Okay, so enough of the theory. Here is essentially what you have at your fingertips now. You have dashboards, which is the highlighted information from your intelligence system, which has information on healthcare, clothing, back to school, utilities. All of this information that typically has been trapped in these systems is now being brought to the surface through dashboards for decision makers, reports, which is more detailed information for policymakers or those who are really focused on more the analytical side, and equally important, providing you with the raw information so your analysts can really dig into the data and find out what the relationships are. How this gets delivered is really up to you. You've got a platform that can be delivered through desktop, through tablet, or through mobile device. So basically the information is available to you in any shape or form. So I want to just walk you now through what has been built. We've designed a set of reports around sort of two concepts. The one is around needs. The needs are what callers present when they call into the 211 system. It's the issues, it's what's presented. So that's information that's sort of collected in one bucket. In another bucket, we have information on your resource directory or database as well. So those are sort of the two logical components that we've built out for North Carolina. So starting here, these are just static screenshots. I'll go into the demo, but you're able to answer some pretty basic questions like how many people are calling and where are they calling from. So this graph on top right, just showing monthly counts and down at the bottom showing counts across your top 15 counties, being able to separate that by year. I'm going to do a live demo on this so you can see how it all sort of interacts. How do the needs of one community differ from another? And every community is different. So we're able to not only dive down and compare one county to another, but be able to compare communities and counties to either communities within that county or across counties. So being able to really segregate that data and digging into, and it'll be easier to see this in the demo, so I won't highlight this too much, but we've broken out your data into categories. So you're able to look at, for example, healthcare, how many people are calling in regards to needs related to healthcare. But if you want to dig deeper into that, we've enabled the model so you can dig in and ask those questions. And of course, on the left-hand side of this screen, you're looking at the total counts per county. So we're always trying to give you sort of geographical perspective on the data, a timeline perspective, which you can see in the top right, 2015, 16, 17 years, and then the target of the analysis, which in this case are needs. Equally important as to what needs were fulfilled is what needs were unmet. So being able to really understand where needs go unmet, where there might be gaps in services and communities, or whether there are some other issues at play is an important thing to understand. So being able, again, to break that out by time, by county, by community, and then understanding what the reason was for the need not being met, such as the not met because the caller exhausted all resources available to him or her. Again, we'll go through this in more detail in a moment. Where are people being referred and for what reason? So this is quite important to understand. You may have a need that is being met in the area of healthcare or in housing, but who are you referring to? So being able to break out that list of who you are referring to, and again, to be able to compare across counties, across communities, across time is important, and information that's very valuable to those who are delivering the services as well. So information that you can share with stakeholders. How many people need additional support, where, and why? So this is information focused on the follow-up calls. So for those who need additional support, and in this case we're showing about 5% of all callers in North Carolina have a follow-up experience with the information referral specialist. So being able to track that information, understand where you need to spend more time and what types of needs are presenting that require more of a sort of a case management perspective, if you will, is important. The demographics, this is something that you do way better than we do. You have thought about the characteristics of your callers and what's important to understand about them. And this is just, as I understand, just the start. It's been about a year and a half, I believe, since you've been collecting demographic data, but being able to break down information such as, does your caller have health coverage? Does your caller have a disability? Has your caller served in the military? What is the age of caller? Being able to really understand your caller demographics is something that North Carolina does extremely well. And this is something that I'll be bringing back and trying to push forward a little bit more in Canada. And of course, all of these demographics can be broken down by community. So that's great. We've sort of shown internally what you can look at in some reports, but you can also present this information out publicly. Some of this information, of course, you don't want to present a lot of this detail out, but in this case, what we're looking at is a report that's being produced, or business intelligence that's being produced with sort of the public in mind, in being able to navigate through your different categories of service, income, transportation, housing, understanding the top 10 referred agencies in those categories, the needs that were presented. So this is designed to be more of a public-facing report of the data, or presentation of the data, and you'll see the interactivity. Jump quickly through a few slides. You'll see this in the demo. Let me stop here. So this is now jumping from, we talked about needs, now over into your resource database. If I recall correctly, there's about 19,000 programs, resources in your database. So trying to get your head around that is complicated, but something that your BI platform can now do. So we're breaking down your resources into the categories on the left-hand side, as you can see there. The community, the education, the basic needs resources, the healthcare resource, being able to filter on those resources, understand where they're located in your community. And by community, I mean right down to the community level, right down deeper than the county level, getting right into your city or community level. And actually, I'll stop right here for a moment. So some rich data coming through as well, and it's impressive to me the quality of the data that's being collected. I've seen a lot of data across the 211 system in North America, and most of us are using a similar platform. But the quality of the data that's being recorded by your information referral specialists is remarkable. I mean, you really need to applaud yourself for that, because working with this data was actually very, very easy. Not a lot of even recommendations as to how to collect it better. So that makes my job a lot easier. So we're able to really dig deep into some of this information, looking at the total services in your resource or your program database, and look at those resources again by county and community level. And this last screen, I'll jump into a demo, gives you a sense, and you can see your counties on the left, but being able to compare one county to another in terms of the level of resources you have across categories such as education, consumer services, healthcare, and understand where your county sort of rates compared to another county. And I understand that that can be, there's context obviously and some expertise that's required in order to understand or draw conclusions from that. But again, this is sort of a starting point. It's not meant to give you the answers directly. It's meant to complement the experience of the frontline staff. Are there any questions before I jump into the demo? And I'm sorry if I've sort of belabored some of these points up here, but my goal is, because a lot of things start moving now with the demo, is to sort of give you a sense of what's coming. Are there any questions either in the room or on the phone before I jump in?
Would you go ahead and define services, because you just had that slide that said services, and Andrew and I have gone back and forth on this, so I want him to define what he means by a service versus a resource.
Yeah, excellent. Thank you. The way in which the information is classified, this is staggering to me, but there's 10,000 possible ways to classify. I don't know how certified resource specialists know how to do this. There's 10,000 ways, a very complicated, not complicated, a very comprehensive taxonomy in which you tag your programs. So for example, you may have service A that actually can be delivered to meet 3 different types of needs. So service A might help people on income assistance, but it also has some healthcare component and some other components. So there's 3 potential uses of that service. So the certified resource specialists, God bless them, they basically tag this information, this program, with those 3 components. So when we tag that same program A, 3 times, those are 3 services. So that's how we define it. So you might have 10,000 programs, but it actually, if you look at it from a service perspective, the benefit to the caller, it's actually threefold. So that's how we've defined it. Thank you for that. So let me kick out here. I'm going to demonstrate this, and let me know if the screen is a bit blurry back there, and we'll see if we can tighten it up for you a bit. So I'm going to start with a presentation of your needs information. And you've seen a few static screenshots here, but what you're seeing here is the top graph, the bars and the lines, are just showing a simple presentation of the number of calls received to 211 across North Carolina, broken out by month. And the line represents last year's number of callers. On the bottom, you're looking at the count by county for the target year. Let me show you how this works. So here we're looking obviously at North Carolina. In 2017, as of September 20th, you've answered 80,655 calls. If you are interested in looking at how that breaks out, for example, for Mecklenburg, you would select Mecklenburg, and then what happens is that the model underneath is being filtered and presenting that data with the perspective only equal to Mecklenburg. If we wanted to look at Mecklenburg for 2016, we then would select 2016 and then Mecklenburg again. And now what we're looking at is the volume of calls by month for Mecklenburg across the top for 2016, and the line comparing the, I'm partly colorblind, so I'm going to, if I say orange, like, that's not orange. The orange bars, Mecklenburg for 2016 and 2015 is the line count. So you're able to go into one or more communities and you can select multiple communities. And this is just showing top 15. It gets more detailed as we move along. But you can see what you're doing is you're interacting with the data model underneath. And even though I've highlighted just the dashboards and the reports that you have available to you, the power of this platform is actually in the data that's being modeled. You're actually interacting with all the data underneath by clicking on all these things. And more importantly, and I'll demonstrate this at the end, you can actually connect live to the data model and create your own reports or your own spreadsheets quickly. And why does that matter? Because what I've heard is before it could take the two, I'm just giving you Canadian sort of references now, but what I've heard is that sometimes it takes an information referral specialist or a manager, it can take a day or two to produce this information because they have to collect it all from the analytical systems, the line of business systems, pull it all in, filter it, and by the time they're done, about a day or two has passed. You can now do this in seconds and you can push that out. That's pretty powerful. My hope is that not only does that happen quickly, which it is now, but actually we start harnessing the power of information referral specialists, certified resource specialists, and business analysts, all those who are involved in looking at the data or creating the data and working together as one sort of big system, because we're all sort of doing the same thing. So when we start using the same tools and talking about these things in the same way, you can really start to harness sort of the collective capacity and resource capacity of the system. So let's look at needs now. This is probably one of the more useful reports I would suggest. And what we're looking at here is a breakout, and I have it on 2017, as you can see it here. So I won't move that around too much. So 2017 data. And we're looking at the total number of needs presented. So when a call comes into 211, typically you have one need identified, but that doesn't need to be the case. You can have multiple needs identified in a single call. So you might have, if you remember the previous slide, we had about 86,000 calls to date, and we have 102,000 needs presented. So you can have multiple needs. So we got about 1.3 needs per call being, 1.4 needs per call being presented here. So we've got a breakout in the donut chart underneath here of how that breaks out across food, across healthcare, across housing, so on and so forth, about 18 different categories. Again, the volume counts across the top, and your county and community counts on the left. Let me show you how this works. So let's look at Forsyth. If we filter on Forsyth, so in 2017, we've had 4,714 needs identified from callers in the Forsyth County. Hope I said that right, Forsyth? Okay. And we're looking now in the donut chart at the distribution of those needs across categories like healthcare, across food, across housing. So then the next question that people typically ask is, okay, but that healthcare, we've got 422 needs that were identified from callers in Forsyth. What's underneath that healthcare bucket? Well, we can answer that question simply by digging into the data. So we're drilling into the data, and this is what the intelligence platform enables. Is now we're not talking about the generic healthcare segment. We're talking about health supportive services. We're talking about emergency medical care, specialty medicine. We're able to drill down. If we want to drill down further, we can get deeper. And what we're doing now, and this is where the taxonomy is really helping us understand. This is the value, from my perspective, of 211 data in the way it's organized. I don't know of any other system that has this kind of quality data. There are 5, so the 10,000 taxonomy terms, as I mentioned, that are labeled to these records, have 5 levels of aggregation. What we're doing is we're drilling down through that level of aggregation. Everyone in North America is doing this the same way. There's some nuances in how the data gets tagged, but we're all using the same way to classify data. This is incredibly useful. This usually makes policy makers' eyes pop when they understand how deep we can go on some of this data. And if you want to look at that same level, let me drill up here to just that second level, so there's not so many slices in the chart. If we want to dig into, for example, let's go back to Mecklenburg. If we want to look at Mecklenburg, how that compares to, as I had highlighted before, Foresight, we're able to really dig through that information and see things change. So that's what we're doing really here, is we're navigating the model through visual representations of that data. Jump over now to unmet needs. So not all needs obviously can be met for a variety of reasons. As you can see on the right-hand side, no provider was found. The caller exhausted all resources available to him or her. They weren't eligible for whatever reason for the service. But understanding why people aren't eligible is an important aspect of 211 data. Being able to then engage in a conversation with whether it be a policymaker, a funder, or other stakeholders, being able to help them understand where there may be some gaps. Again, it's not going to be the only information that's used in order to make decisions, but it's another piece of the puzzle. So being able to navigate why needs are unmet, for example, in utility assistance. So if we want to understand why needs aren't met with calls related to needs involving requests for assistance around utilities versus housing, the list goes on. If we want to dig into any one of those particular areas, I'll stick with healthcare for the moment. But if you want to understand how those unmet needs are broken out across healthcare, we can do that as well. So digging into this data is an important aspect, but also being able to carve it up by county is important as well. Referrals, I pass over this quickly because this is a similar chart as to the needs, but what we're talking about here is where people are referred to. So obviously there's a close relationship between the need and the referral, but what's different about what you're seeing here is what's on the left, what's chopped off on the left-hand side for you in the room, but not chopped off on the phone, is the county of the caller. So if we were to be another area, what county do you want to see?
Like a Salvation Army would be a good one for this. Salvation Army there.
In what county should we look at?
Does Guilford have one here?
Here we go.
Or even Cumberland County DSS.
Cumberland County DSS.
Right there, I'm sorry.
Right here. So now what we're looking at is we've filtered on Cumberland County DSS. 926 referrals have been made to Cumberland, short form at DSS. But more importantly, what we can understand, and from their perspective, why were they referred? What needs presented that resulted in the referral out to DSS? So on the left-hand side, and this is just to simplify the list, we've got the top 25 agencies that are referred to in each county. So every county is different. So we're able then to dig into either at the county level or into the service agency that the referral is made to and understand why the referral was made. And if you want to be able to compare across years, well, simply select the different years. And if you want to dig into a particular month, and there's an interesting piece of your data that I know is actually coming down yesterday, we're able to do that. So again, we're filtering and we're sort of going across the data model to ask questions of the data. Very briefly, your follow-ups, as I mentioned, you're able to dig into your information to understand what the nature of the follow-up call was. So for those who need a bit more support, what are those types of needs that we're presenting? Where are they being presented from? For example, in Guilford, 232 follow-up calls were made this year. So probably about 400 by end of year, and you can see the distribution across the month. The demographics, as I mentioned, really great start to collecting demographic data, and something that we need to learn from you on is the types of questions that we ask callers. You don't ask all these questions, obviously, but where it's appropriate to ask the question, of course, the data is all anonymized. Able to answer questions such as, of the 80,655 people calling 211 to date this year, how many have disabilities? Nearly 1 in 3. I would not have guessed that. And if you want to filter on that data to understand where those people are coming from, by filtering that data, we're actually filtering the other data. You'll notice that the data is changing everywhere in the report.
That's actually no. Yes, it is.
Oh, I'm sorry. Okay. Yes. Thank you. All right. Colorblind and can't read. So 17% of all callers are reporting a disability. Very, very important information to collect. Serving in military, and you're seeing sort of some of the aspects of BI2, the rollover gives you the actual counts. Again, filtering the data across your counties, understanding the number of callers per county that are reporting serving in the military. Have insurance, health insurance, being able to understand what that looks like across your county. So again, it's really sort of the question that you're asking of your data and then going to the information. Hopefully it's in the report. If it's not in the report, then you have access to all of the data underneath in the model, and not the raw data, the model data. So you're able to, as I will demonstrate to you, be able to quickly pull reports and information together, which an example would be, we get this, I used to get this all the time in Ontario, you get a call from a funder, or it might be, in our case it was the provincial government, saying we need to know the number of callers who are asking for assistance with housing. And so I would always ask, when do you need that by then? When do you need that by? I'd always be, wow, maybe in an hour? So of course we never used to be able to do that before BI. So I'm sure you get that kind of request as well. So again, being able to, if you can pull it out of the reports, great. If you have to pull it out of the data, it's already there modeled for you. This is the public presentation that I was referring to before, and this is a bit busy for public presentation of data. I wouldn't suggest that this sort of be the first step when you present your data publicly, but business intelligence now, the tools have evolved to the point where you can really present some easy ways for people to see your data quickly. So for example, if we were to look at, I'm going to focus on healthcare again here. By selecting healthcare, what we're doing then is changing the title at the top. So we're going from all categories where you have 102,948 needs identified across North Carolina in 2017. But if you want to drill down to healthcare, it'll change the title. So this is a nice way to present your data to the public, presenting these big buttons on the right-hand side and allowing them to filter through. So you have to think a little bit differently about how you present this information. And what we're presenting here is the type of need that presented, the top 10 referred agencies this year. Again, we're focused still on North Carolina, and then the specific needs identified in the table on the left. And probably equally as important, on the left-hand side, I'll check Guildford again. By selecting Guildford, you'll notice on the top right-hand side, if you take a look at the top right, you'll see North Carolina switches to Guildford. We're still in the healthcare slice of the information, but now we can see 479 needs were identified, and then look at the data, how those needs sort of presented over the course of the calendar year. We can look at the specific needs identified, and if you need to dig down deeper into those specific needs, you can do that. And the top 10 referred agencies, in this case, Guildford, for needs related to health care. If you're more of a map person, the Esri, probably the world's leading geographic information system company, has embedded products right inside of, or embedded their services right inside of the business intelligence platform. And now what we're able to do is take a look at how, I won't go into the map what it's showing here, but you have more of a visual view of North Carolina and understand where, for example, the darker areas are where more needs are presenting versus other areas. Now, again, this is where it's really important to understand the business of 211 and not just make decisions based on the data. So, for example, it can be easily argued, and I would agree with this, is that some of these areas, if you do not see a lot of needs presenting, could be because 211 isn't as well known in those areas. But still valuable insight in terms of where do you invest dollars in order to create greater awareness. It could also be gaps in services. If you want to dig deeper into the maps, here we are only showing the 18 categories of the data. But if you want to go really deep into this information, you can break out all of the 18 categories into subcategories and so on and so forth. So you're really drilling into this data, again, moving through the levels of the needs as required for your analysis. And the last piece, and this is to demonstrate that typically we think of when we're doing mapping exercise or trying to group things from a geographic perspective, we typically think you have county boundaries, we have municipal boundaries, but they're distinct boundaries, and often there's information that's available for people who are mapping information. United Ways actually are all mapped based on posts.
Well, it's zip code, basically, but yeah, they all have unique footprints. Some
So-
are simply a county, but others have a unique configuration.
So here we're able to present, rather than the county, we're able to regroup all of this data by United Way catchment area, because at the end of the day, it's just a geographic space. So we're able to look at the United Way of the Greater Triangle catchment area footprint, rather, and look at the needs identified. So it's the same chart as I showed you before, except rather than presenting county, we're showing United Way. I think this is what I've been told in Ontario, is that this is very helpful to be able to talk to your donors or your constituents, because this is your perspective on the needs. So being able to regroup this information is quite straightforward with the intelligence platform. I'm going to bounce over to resources to demonstrate a few reports. It's not as long. Is there any questions either on the phone or in the room in terms of what you've seen so far? Okay, let me bounce over then. Everything's an app these days. If my kids can't swipe it, it doesn't exist. Okay, so we're gonna dive over to the resources report. I just want to highlight a few things for you. So no longer are we talking about needs, we're talking about the resource database. Sorry, it's cut off a little bit for you in the room here on phone, it should be fine. But what we're presenting here is basically a map of the resources in your 20,000 plus resource directory. So you're able to carve into, for example, if we wanted to look at basic needs, it'll remap basic needs. In this case, I've got Buncombe highlighted. Let me select, what county would you like to look at? Keep it on Buncombe? Okay. So let's stay here then. All right, so Buncombe. So this is all being driven, I'm on the internet right now, I'm connected. This is all being driven out of a web browser, if you hadn't noticed. So that's how quickly this is happening. So for Buncombe, we can see, for example, let's take a look at basic needs. It's remapping this data based on needs for basic needs rather. And if we want to dig in a little bit deeper into basic needs, like what exactly are we talking about here, we can drill into this. Too quick here. There we go. Oh, my mouse isn't working, sorry. We're able to drill into that next level. You just sort of have pictures in your mind. Sorry about that. My mouse isn't hitting the button. So we're drilling down into that second level of basic needs and being able to look at, if we wanted to look at a particular community in Buncombe, we could do that as well. So if we wanted to jump into, where do we want to go? Asheville, okay. So you're interacting again with the data model, and it's helping you visualize resources. In this case, we're looking at, you see the title changing up here, Asheville, Buncombe. We're going to look at healthcare resources. You see the title change again. So it's shifting focus as we move across the resource directory based on the perspective, education, healthcare, whatever it be. So being able to compare one community against another or county against another is something you can do with your information. This is very similar, except you're getting all the information in one spot. If we wanted to dig down into on the left-hand side, we're looking at all the categories. If we want to open up those categories, this is the button that I couldn't magically push on the previous report. So we're looking at how, for example, family services break out by individual and family supports, volunteer opportunities, mutual support services. And what we're looking at here is across North Carolina, on the right-hand side of your metrics, looking at the number of agencies, the number of locations, the number of programs as we drill through the data. So for example, if we want to take a look at the number of individual and family support services in North Carolina, once we filter on that information, what it's doing is it's actually recreating the metrics on the right-hand side. So you get a really good sense of the services available in your community and the number of agencies that we're dealing with. And if we want to dig in again to the into the data based on county, we can do that as well. And the last one is a representation of your data. Go back up here. What we're looking at here are those main categories of classifying your resource directory across categories such as basic needs, education, healthcare, and being able to compare one county versus another. So understanding how many resources are available in one county versus another. So in this case, we're looking at Forsyth. If we wanted then to jump over to Mecklenburg again, sorry, I wish I knew your geography a little bit better. We jump to Mecklenburg, then we can take a look at sort of how the resources in Mecklenburg and Forsyth compare to the line, which the line represents the total number of services per 10,000 residents, so in North Carolina. So bar underneath line means that there may not be as many resources available, or perhaps the communities are so close together that a neighboring community has a lot more resources than the state average. So different ways of looking at your data. The main point that I would like to make here around the reports piece is that this is the start of probably quite some journey that you're going to be on, because these are reports, you think of this as a starter kit. This is just the tip of the iceberg in terms of what you can produce. If you want to produce your own information, we can do that. And again, I'm in a web browser, so I'm just in Chrome. If we wanted to take a look at the 211 needs report, you can see here the data being presented on the right-hand side. Sorry if it's a bit small in the back. But if we want to start creating this information or create our own reports, we can start digging into the data by asking total number of callers by, let's say, United Way. This is going to be a monster chart, but as you can see. But what I'm doing here is interacting with the data model. I want to represent that differently. We can do lines, or if we want to do, this will be really ugly. But what we're doing is we're interacting with the data model live over the web. So you're able to create your own report quickly, and if you want to filter those items, because let's say I think there's about 50 plus United Ways in North Carolina, we would drop that onto the page. And let's select, I'm just randomly selecting some here. But what we're doing now is highlighting, we're basically drilling into the data for that particular United Way. So you're able to interact with the data model and create all of the reports that I've presented today. To create your own information, you may want to use that internally, present it internally. You may want to share it out to the web. You can do that as well. And the last thing I want to demonstrate is this often isn't good enough for the data analysts, right? It's like, yeah, we've done all that. Seen it, we know what a model is. I'm bored up to this point. Show me something more. This is my favorite feature in the data model that's being built, is what you can now connect directly to the data model. Again, I'm still operating over the internet, but I'm creating a live connection to the data model and opening up that data inside of Excel. So now you can take basically all of the power of Excel is at your fingertips, and you'll see all of the data in the model presented on the right-hand side. So if we want to do that same report, but it's more tabular format, looking at the total number of call reports by, sorry to scroll through a lot of this, let's say the the county of the caller, and let's do that by, take a look at that information by year. We now have a tabular report of the counts of all 211 calls separated by year, separated by county. And if you're more of a visual person, well, we can turn that data into a chart for you. So so for those who are very familiar with Excel and the power of Excel, the data model is connected directly to that tool, and you can start basically working with information that's been modeled and cleaned and you can trust to help make decisions very quickly.
Will you do one other example? We have our friends from DHHS here. We added, I know, the filter to be able to do it by our initiative type. So that's our No Wrong Door LTSS project. Can you just do one example of how we'll be able to show the data around those No Wrong Door columns?
I should have prefaced it with any question I get has to be an easy question.
Oh, sorry.
no, let's do it. No, I'm joking. Let's see. You're going to have to help me with this one.
Okay, I think I know where it is.
Okay, so you want to know total call reports.
Then it should be, I think it's under
What is it by? It's by,
initiative.
oh, okay, all right.
I thought you had it actually in the other piece. You don't have to do it here if you don't want to. If you'd rather do it on the call data. On the call data. Yeah. There's an initiative type. So scrolling down to the eyes. There you go. Under
Yes, okay, here. Thank you.
It should drop down.
And this,
See what happens with that.
let me take it out of here. Take out the county piece. Drop it down into initiative type. There you go.
Yeah. So then it has all the initiatives there, but you can see how we would be able to isolate it down to one initiative if you wanted to, right?
Absolutely. Yeah, we could drop the initiative in as a filter, and you have that information. You create a graph out of it, and you can also chart it over if you want to. Actually, here's something. You could take a look at these initiatives.
Well, what's cool here, though, is it's showing at the bottom there where it's connected. So you see the No Wrong Door callers that also got screened in Charlotte for homelessness, or also got offered the diabetes initiative, and I think I saw some that were connected to Hurricane Matthew. So I mean, that's actually then showing us the connections of those initiatives, which is something we've not been able to do before, which is really cool.
So 356,980 needs related to, or call reports rather, related to these initiatives over time. Yeah, so being able to chart that. So you have full access to the data underneath. This is not something that you need a report developer or anyone else for that matter to help you get at your information. So that's even though reports and dashboards and things that look pretty and you can click always get sort of the spotlight, it's really the data model underneath that is the value in the system. And again, I cannot emphasize enough how important it is that the data that's actually created in the first place on the lines is still, it's remarkable to me that for me, I'd be fired the first day. Like information referral specialist, like being empathetic. First of all, I'll probably get fired on that.
Yeah.
Alone, but being empathetic at the same time that you're making a referral, at the same time collecting this information, absolutely phenomenal. That's really, 211 is near and dear to my heart just for those reasons alone.
Share, and we hadn't told you what you learned yesterday about Robinson County.
Oh yes, absolutely.
Emergency management here too, so I want them to
Absolutely.
see how quickly and easily you can see there's a problem.
Yeah, thank you for that. So when I was, before I flew down actually yesterday, I was looking sort of for stories in your data, and for me, because I don't have the context obviously of North Carolina, I was looking for things that sort of stood out for me. And one of the things that stood out is when I was looking at 2016, let me blow this up a little bit for you, sorry. This popped out at me. October 2016, boom, chart up there, right? This is usually there's like a whole bunch of stories and behind, what I call a boom, a little bit of a bump in your data. So I thought, well, that's interesting. I said, obviously something happened there, and I was thinking, October, could it be hurricane? But from there, what I simply do is I select October, And now what I can see is disaster services made up 40% of all of your referrals in October. And if we were to compare that, for example, to June, where there was, as I know now, a hurricane, you can see disaster services, it's on the chart somewhere, but it's so small you can't see it. So, but it's incredible to me, and this is obviously this is one of the important sort of value adds of 211, is that 211 activates in times of emergencies to support the front line and the emergency first responders. So to be able to call that out in the data was one thing, but then what I was also able to do, again, I don't know North Carolina that well. Love Raleigh. Raleigh's beautiful, this whole triangle area, so be back here again. But what I was able to do is by selecting October, and you'll see this, let's select July here. On the left-hand side, you'll see the top 5, 6 counties, probably the most population, the total needs identified. We jump over to October, and you'll see what comes to the top of the list is Robeson. I hope I said that correctly, but Robertson, Cumberland. So it switches very quickly. And what it said to me is that 211 activated well in these areas during times of emergency because it was a remarkable number of calls. If it was 40%, then about 14,000 calls were
So then
answered.
if you click on that county, how does it impact the needs donor?
So if we then click on, say, Robson, we can see, there you are, right? Coming in around less than 100 calls in 2016. Hit October, you're at 4,100 calls from Robinson. So, I mean, for me, I was looking for just something in the data that stuck out, and that one obviously popped out at me right away. So it allows me to sort of jump right to the question, what was the disaster, right? So then I looked it up on the internet. It was Hurricane Matthew, sorry.
And
Hurricane
then we could
Matthew.
also look and see who those people were, right? We could also look at the demographics of those people as well. Take down that.
Absolutely could, yeah. That's the beauty of the data model. Then you can start traversing it and asking different questions. I saw this in October, it was in Robinson. What were the types of calls, and then what was the makeup of the caller base? What were the demographics? Were they people who were on income assistance, had disabilities, whatever it might
Do you
be?
have time to show that?
Yeah, I think
I probably can't do it just because I don't have my, full stuff here. Sorry.
It's not live.
Yeah, it's just too. You're gonna test me too much.
No.
So that's what you have at your disposal now. It is the start of what I think is probably going to be a long journey into community intelligence using these tools. I'm really looking forward to spending the next, I guess, a day and a half with a number of people, I think, in this room right now, in training you up on these tools. I think you will be amazed at how quickly you can do some of the things that I've demonstrated today. So, and as I mentioned, what makes me smile is when other people can do this. And that's really what this is all about, is bringing new capabilities to the 211 system. I guess one person at a time in some respects. Today it'll be more than that. So.
Andrew, can you speak to what's coming next with the metrics and the search data?
the call metrics of the 5.9 of the website.
Oh, absolutely. Yes. Yes. So I'm very pleased to be evolving this with you. The platform right now, I showed you the resources and the needs data. What will come into the platform over the next couple of months is call data. So you'll actually have metrics on your calls, how long it takes to answer a call, whether the call was abandoned. In some cases, always a small percentage of calls that were abandoned, but some really rich metrics around the call. And combining this data, which is incredible because you can take data from two different sources, for example, your call system and your call reporting system, and answer questions such as, does it take longer to answer a call related to healthcare versus housing versus information services? So being able to sort of bring that data up. So the call data is coming soon with some great metrics there. And as well, what I've presented today is caller data. These are people using the phone to connect to 211. What will also come next is contact. data. So those who are interacting with your site that are using other channels to get at 211, you'll be able to report on that as well. So this, again, is sort of the tip of the iceberg for you and the rich metrics that are available for you. And I look forward to hearing the stories that come out over the next couple of years in terms of how you're using this data. And giving back in terms of a community, because I believe that what we'll see across North America is 211 starting to leverage, understanding the value of the data that they collect and starting to present it to those who would really benefit from it. So being able to share that back into the system in terms of your knowledge and learning, because congratulations, you're the first state up on this platform. So that concludes my presentation. I want to thank you very much for coming out today, and those on the phone, and for Laura and for Heather for having me down here. It was a wonderful opportunity. Thank you for giving that to me.
Thank you. I just wanted to thank our partners that are here today, Emergency Management, Division of Aging and Adult Services. iCarol is on the phone. They're our platform partners and have been a great partner in helping Andrew develop the model for North Carolina. So thank you, Donna. I know you're on the phone there somewhere. Also, the board members that are here today, as well as those that are on the phone, thank you so much for being here. For the 211 team, you know what, if you hadn't put that data in and you hadn't been so persistent to get it to the place where it is today, none of this would be possible. So to both our Asheville-Buncombe call center and our Durham call center, thank you. You guys rock it all the time, and our data team as well. So, and Heather, of course, for working with Andrew to kind of get this to where it needs to be. We'll continue, and Rob's a part of our team back there too. So, you know, thank you for coming today. I know it's a little overwhelming. This is the third time I've seen it, and I'm still like, am I really going to be able to do that? But we'll see. Tomorrow will be the telling tale. But we'll be showcasing this at different venues. We'll have another webinar with our United Way. So if you want to join us again, you're always welcome. And we're also willing to come out and give you an individual model once we learn how to do that. So thank you again for coming. Bye, guys. Any other questions? Okay, thank you. Thank you, everyone, for joining on the call.